Following the COVID pandemic, we had, I think, observed that COVID didn't just affect us through the COVID-19 itself. Many other things were affected, and that included other services of health, particularly NCDs. So we had people with high blood pressure, for example, not being able to either access the medications in the hospitals. People with epilepsy or things that were not related to COVID-19. So they didn't necessarily need to have COVID-19. But these were just some other things that we were looking at. And observing that the changes, so we know that what causes, the top 4 causes of disease and death in Fiji and in the Pacific right now, the top 4 are all NCDs. So we know diabetes, there's cardiovascular diseases, cerebrovascular diseases, and cancers. All of those 4 are non-communicable diseases. And so our college at the College of Medicine, Nursing and Health Sciences through the Fiji Institute of Pacific Health Research were looking at opportunities to investigate lifestyle issues and lifestyle problems and how these are further complicated by a disaster situation such as a pandemic, and more importantly is who are the players in the communities that can help address the problem. So one thing we found in a setting like ours here in Fiji is the important roles that our faith-based organizations play. Because almost everyone in a society like ours, we have a faith. You belong to a faith of some sort. And so in this study, this project set out to understand how our faith-based organizations are prepared to assist their members, members of the faith, when we have a situation of a disaster such as the pandemic. So understanding if there are policies in place, if there is a strategic plan in place for each of the faiths or the faith-based organizations that allows a structured planning and interventions when things like a disaster happens. So what they did was the group conducted key informant interviews with leaders of each of the faith groups, and the faith groups that were included were the Methodist Church, the Seventh-day Adventist Church, the Hindu, the Sanatan Dharam organization in Fiji, the Fiji Muslim League, the CMFI Church, and the Catholic Church. So these are, I think, of course there are other faith-based organizations that were not reached out, but in phase 2 of this study, there is intention to reach out to those groups. And just finding out, again, how are we prepared as a faith-based organization to help our members, and I'm speaking on behalf of the faith FBOs, during these sorts of times. So looking at whether policies are in place, what happens during those times, whether we actually have any, screening activities, for example. And in this stakeholder meeting today, we're just hearing the preliminary findings of that study that's being shared in today's workshop.
So you speak about disseminating information to the public, but why is the second session closed to the media?
Why is the second session? No, I think so. So we're opening it, and so it's open to the media, and we're sharing it with as the preliminary findings. Again, you can stay. I don't know why you're recording, whether you can stay or not stay, but so you can stay. The narrative of the story will run through our PR at FNU, and of course, you can share that with your own. And again, they are preliminary findings. So these are not the final results. We still have to analyze bits of the data that's being collected, and so it's important that I think when you generate or when you write your reports, that it's capturing the full report of the study. Yeah.